Do you think your teeth are touching during the day? And why could this be a potential cause for any facial pain you might be experiencing, or in particular temporomandibular joint pain? So many of us believe that when your teeth are in contact during the day, we call it a light form of clenching, right? So any type of tooth contact is a form of clenching, and we believe that that can overactivate your closing muscles, particularly like your masseter and some inside muscles called the medial pterygoid, and for sure your temporalis, which occupies the whole side of both sides of our head. So one of the things we like to instruct in during the day to break what we call clenching as a type of parafunction is the idea that really your teeth should just have a millimeter or two of what we call freeway space, meaning they should not be touching. And one way to achieve that is by something we call the rest position of the mandible. And most of us believe that with our tongue up in a very particular position, lightly touching the hard palate or the roof of our mouth, causes a reciprocal or a inhibition or the lack of ability for our closing muscles, the masseter and the medial pterygoid and the temporalis, to fire to an extent that might cause lactic acid buildup, and then as a result, facial pain, TMJ pain. So one of the things we teach people is putting their tongue lightly against the roof of their mouth, particularly the raphe. So you don't want your tongue pressing against your upper teeth. It needs to very lightly touch the upper roof of your mouth or the raphe here. And one way to typically achieve that is by having patients say the word N or the letter N or the word nice. And generally for most of you, when you say the word nice and you hold the N, your tip of your tongue will lightly be on the roof of your mouth. So you should not be pressing hard. It should just basically, it almost sits up there through sort of a negative, a suction type of effect. So your tongue is lightly touching, and as soon as your tongue is lightly touching that portion, you will notice your teeth will separate by a millimeter or two. And then, of course, we would always like your lips to achieve closure, meaning in general, our lips like to be touching lightly as well, because we should always, if possible, be breathing through our nose. Now, we're making the assumption that you're healthy, you don't have any nasal obstruction, severe allergies, that type of thing. But the process of the rest position of the mandible is lips are together, teeth are not in contact, your tongue is up in the N or the nice position, and you are breathing through your nose. That's the rest position of the mandible, which just that simple task, reminding yourself all throughout the day, can minimize a significant amount of parafunction and can significantly reduce any muscle-related pain that might be due to any temporomandibular joint problem.